Nutrition is the foundation for so much of what we do in health, but admittedly, it can be hard to know where to start and also tough to know if you're on the right track. Which is why in today's video, I'm going to give you 3 simple tips that you can use to improve your nutrition and diet so you can see progress with your health and symptoms if you've been diagnosed with Hashimoto's. Hey everybody, my name is Dr. Brad Bodel and thanks so much for checking out this video. I specialize in helping women with Hashimoto's and hypothyroidism to improve their symptoms naturally, and I make content to help you guys do the same. If you like this information, don't forget to give this video a thumbs up and feel free to stick around by subscribing to the channel. I post videos every Thursday morning and try to make sure that you guys stay up to date on the newest and best strategies that you can use to support your thyroid health. But before we dive into the 3 tips, I wanted to first start off by giving you guys a little bit of context in terms of the way we should approach our nutritional choices. And it's something that we've talked about before, but I like us to think about our nutrition as being a bit of a spectrum or a sliding scale, and I think it's a good concept to keep in mind, especially when we're first starting out. When I explain things to my patients, essentially, on one end, we have a very relaxed approach to our nutrition, and on the other end, it's very restrictive and nuanced. And in between, we have everything else. Now I realize that this can be frustrating for some people, and I've had people tell me before, just tell me what to eat. But the thing is, where we land on that spectrum is going to be determined by who we are as an individual. Things like the severity of your symptoms, how willing you are to make changes, your nutritional education and background, and what your relationship with food has been in the past. All of these are going to have an effect on where you land. So do I think going gluten and dairy free can be massive for people with Hashimoto's? Yes, but I also have people who come from a background where they're eating a lot of packaged foods, eating out all the time, and to go gluten and dairy free to start is too big of a change. Sure, without some of those more advanced protocols, we might not see all the improvements that we'd like. But at this stage in their life, it's likely better to give them a few recipes that they can manage at home and start making a little bit of that shift. Once we get our feet wet, then we can start making some of those additional modifications. Of course, when I'm working one-on-one with a patient, I know what their health history looks like, and I know what their labs look like. So it's much easier for me to give them a specific structured approach to what their nutrition should look like. But for those of you watching at home, you're going to have to do a little bit more testing to figure out where you fit. And of course, if you're having any trouble with that, you can always leave me a question and I'll do my best to answer it. But that's why, in an effort to give the most help to the most amount of people, I try to give you guys those big stopping points on the nutritional highway. That way you can structure your choices around these key concepts. So if you want to make some nutritional changes to better support your Hashimoto's, this is the progression of the spectrum that I present to my patients. But remember, just because I describe it in a linear fashion doesn't mean that we have to start at the simple end and progress to the complex end. And hopefully, by describing all these key points, you'll be able to jump in at the spot that fits you best. So on the side of the spectrum where the changes are a little bit easier and a little bit less dramatic is a whole foods diet. And I think this is a good concept for people with thyroid issues and for people in general. When following a whole foods diet, for the most part, you want to be cooking from home, choosing foods that have single ingredients, and avoiding pre-packaged items that have a lot of added sugar and processed oils. Once you feel comfortable with that approach, which usually teaches you a few cooking skills, how to plan ahead with your food, and develop a list of recipes that you like, then you can move on to the next step, which is removing some of the more common food allergens for people with Hashimoto's. So our next layer, or our next stop, is going gluten and dairy free on top of the whole food structure that we've already been following. You guys know that I often mention that just because a food is labeled gluten free doesn't mean it's healthy. And there's a lot of processed gluten-free foods that are trying to masquerade as a healthy option. But if it's our first time even thinking about going gluten and dairy free, then choosing some of those replacement options might be a good choice. No matter what way we go about it, if we can reduce some of the inflammatory food proteins that we're eating, then even though it's likely not going to fix all our problems, It will probably help to reduce inflammation and give us a little bit of confidence as we see these changes conferring further benefits. After we get used to limiting gluten and dairy, even if we've only been following the letter of the law and not necessarily the spirit, then our next step is to move into a paleo style diet, which is also similar to a Whole30 style diet. With paleo, you're going to be eating whole foods just like you were before, but let's say you were having a gluten-free pizza on the weekend, which, yes, use gluten-free flour, but we know there's some things in there that might not work well with your system. Now is the time to take that next step and remove some of those additional processed grains. We know that the proteins in wheat can look similar to the proteins in other grains. And if our system has already lost tolerance and is highly reactive, then it's common for us to see people not only reacting to wheat, but all the things that they use to replace it. That includes things like our millet, sorghum, buckwheat, quinoa, oats, and the like. Yes, these things are technically gluten-free, but if you're continuing to have symptoms, then it makes sense to take that next step. So with paleo, you would be eating meats, vegetables, fruits, nuts and seeds, healthy fats and oils, and herbs and spices. And depending on who you talk to, they may or may not include things like legumes. And finally, our last main stop is to transition that paleo diet into an autoimmune paleo diet, or AIP. Once again, AIP is going to look very similar to our previous stop. But just like paleo took whole foods and removed some of the common food allergens, AIP takes paleo and removes the less common food allergens. The big three here are nuts and seeds, nightshade vegetables, and eggs. And depending on your feelings on legumes, if you weren't having them before, then you can continue to avoid them. But if you were having them before, now is the time to stop. As a disclaimer, I always like to note that I'm not necessarily saying that these are bad foods or that they're unhealthy, but they are commonly an issue for people with an inflamed gut and poor thyroid function. And this is where we have to, again, check in with ourselves. How are we feeling? What do our symptoms look like? If they're continuing, then removing this additional group of foods might be what we need to get further clarity. When it comes down to it, within reason, I really don't think that there's one diet that is better or worse than another. They're all just levers or tools that we can pull and use to help support our health at a particular stage in our life. And the better that we can be educated and understand these approaches, then it makes it easier for us to find the right fit. So I know that was a little bit of a detour, but hopefully it was helpful to you. And as I said before, it should help to provide a little bit of context for our 3 tips that we're going to discuss. And after we've gone over all those little different details and nuances, our first tip is picking a nutritional strategy that you can be consistent with. So let's say one time your friend convinced you to do AIP with her for 1 week, and you felt the best you have in years. But since then, it hasn't been all sunshine and rainbows. Maybe work has been crazy, maybe you had to move across the country. For whatever reason, AIP isn't working with your life right now. So even though in your heart of hearts, you know that AIP is probably the way for you to go, what good does it do you if you can't stick to it and the mere thought of it is increasing your stress levels? And the answer to that, of course, is no good at all. So do research, know what's required, and pick the one that feels best to you. But also be honest about what's going on in your life. If you can't be consistent with your nutritional approach, then you won't see benefits and you'll likely be more frustrated than when you started. Once you find a structure and approach that fits, don't worry if it's not perfect right away. Not only can you change at a later time if you'd like to, you're probably going to have to do that. Life changes, our health changes, our goals change, and therefore it makes sense that our nutrition would change along with it. Oh, and one more thing while we're on the topic. Once you choose an approach, don't get caught up in the teeny tiny little details and nuances. They make much less of a difference than you think they would, and you stressing about it is going to far outweigh the benefits of you attending to them. Alrighty then, on to tip number 2, which is when switching to more of a whole foods diet, you're going to want to increase your portion size. Now, of course, the caveat here is that if you have a very sensitive gut, having larger amounts of food might not be good for you. But on the by and large, I see people making this mistake all the time. You know how many calories are in processed foods like donuts and muffins? Well, maybe you don't want to know, but it's a lot. And it comes in a relatively small size portion. But because so many of us have had eat less, exercise more drilled into our head, we end up carrying that philosophy from our processed food diet to our whole food approach. And when it comes to whole foods, they are inherently less calorically dense. So if we keep the portion size that we had before with our new approach, it's going to leave us fatigued, hungry, and irritable. So as you're making these changes and improvements, I want you to get that focus on caloric restriction out of your head and instead realize that when you choose the right foods, you can eat them in a way that is nourishing to your body. And I know this might sound crazy to some, but just because we're changing our nutrition in a healthier direction doesn't mean we need to starve and suffer. And finally, tip number 3 for improving your Hashimoto's diet is remembering that no matter how good your nutrition is, it isn't everything. I can't tell you guys how many times I've had a patient come in and say, Dr. Brad, I ate perfectly this last week, but I didn't lose any weight, my brain fog was worse, or I noticed an increase in joint pain. And that's because, again, nutrition isn't everything. But the reason why I share these stories with you guys is I think it's important to realize that we all have our ups and downs. And sometimes, in the world of Hashimoto's, it can feel a little isolating and lonely. Then you add to it the fact that you've been on point with everything and haven't been seeing the results that you want. So what's the deal? Well, just like I said before, that you need to get away from all those little nuances that can drive us crazy. If you've been doing well with your food, but you're not seeing changes in your symptoms, then it's probably something else. So if initially, changing your diet led to a big improvement in symptoms, but recently you feel like you've hit a stall or regressed a bit, then I might not start tinkering with the diet as my first strategy. Instead, it's time to look at all the other things that are going on in your life. How are your stress levels? Are you getting consistent, regular daily movement? Are you getting quality sleep at night? It can sometimes feel a little overwhelming, but these are the things that we have to consider. My pro tip here is look for things that have changed. If you were following a dietary approach last year and things were great, and you're following that same dietary approach this year and things aren't so great, then again, what is different outside of the dietary choices? This is why health is hard, and it's rarely just one thing. That's why we have to keep things simple, take it one step at a time, and keep the good and throw out the bad. If you can continue to learn, innovate, and adapt, you'll be able to continue to build yourself up and move forward even if life gets a little crazy. But let me know what you guys think. What was the first change you made when it came to nutrition? And did those changes look the same 1 year later? What has helped you to stay consistent? And what have you learned on your health journey? Leave me a comment and we can keep the conversation going. Besides that, if you're looking to add a practitioner to your team and want to work with me one-on-one, you can apply for my program by sending me an email at contact@seattlethyroidhelp.com. If you qualify, I always offer a free consultation, which allows us to discuss what's going on with your health, ask me any questions that you might have, and make sure we're on the same page and have the same goals when it comes to what you want to achieve. The consultation is absolutely no pressure, and at the end of the day, we just want to make sure that things are a good fit for you. And of course, if you have any questions about the consultation in general, you can use that same email address and it's listed for you in the description box down below. But that's all we got for today, you guys. Hope you liked it. Love you being here. And I hope that this information is translating to big wins in your own life. As you guys know, I'm so proud of all the changes you make, and I always think that not only is it a benefit to you, but it's a benefit to everyone who's around you and relies on you. If you want to learn about more ways that you can help to support your thyroid health, then make sure to follow me on Instagram or Facebook and check out some of my other videos. If you like this one, don't forget to give it a thumbs up, subscribe to the channel if you haven't done so, My name is Dr. Brad Bodel. Hope you guys are having a great week, and I'll see you next Thursday.